Good morning, Wolford Health Centre. How can I help?
It could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
There's a viral bug that's causing a bit of sickness, a bit of vomiting.
But yesterday, someone told me if you're puking up, you could have stomach cancer.
I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me?
So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore.
You need to bring your arms slowly forwards.
Oh, ow, that's new.
Good morning.
Are you all right? Filled out all the forms and stuff.
We're all good to go. Hopefully you won't be sick, but welcome to the practice.
Thanks for your help. Cheers.
All right, thank you. Bye-bye. OK, hello, everybody. All right, you have a seat. How are you doing?
My chest is quite bad.
Right, OK.
I had a scan on Friday.
Yes.
And the baby's fine.
Yes. That's
Really
good,
worries at
isn't
the
it?
moment, yeah.
Yeah. So how long's the chest been a problem for?
Over the weekend.
OK.
I don't know why. I don't know if it's changing weather or changing hormones. I don't know.
Yeah, and tell me a bit about it.
I'm just struggling to breathe.
OK, so sort of tight.
Yeah.
Yeah.
Can we come off of there, please?
And remind me, you're asthmatic, yeah?
Yeah.
And you take 2 different inhalers, yeah?
Yeah.
Have you haven't had that many of them actually, have you?
No, I had spare ones at home, but
yeah,
I haven't. I'm just on my last one.
Okay. What do you think's going on? Tommy, I'm going to give you something to do. All right. Can you do a drawing for me? Okay.
Sorry.
It's all right. So let's just see what your temperature's like. That's normal. Is the pen not very good? What you have to do is you have to hold the pen so it's like that, OK? Do you want one too? Yes? Okie dokie. You're good at drawing. OK, there you go. OK, so let's have a listen at the back first, just to breathe. Oh, that's fantastic. Oh, you've written your name. Wow. Can you do that again? You are quite wheezy, actually. Let's see what you get on this. $300. So that's a bit down.
Hopefully I can be fairly brief.
Oh, well.
In 2012, I came to the surgery
Yeah.
to talk about jock itch, because I was getting itchy.
Right.
So he gave me some Dactocort
Yeah.
thing. And it's never really gone away, 5 years later. And then, obviously, a lot of it's out of sight. And I took a photograph of my buttock about 3 days ago, and I thought, well, actually, I need to try and do something about it. I presume that's all part of the same...
Probably.
Same thing.
Yeah. Can I have a little look today? Is that
Yeah.
right? Do you want to go behind the curtain, or are you all right?
I'm not bothered.
And is it itchy?
You know, the general itchiness, you know, it comes and goes a bit.
Yeah.
There's up the crack there.
Yeah. Is there anything around the front?
Well, it's often a bit itchy underneath.
Yeah. There's not much to see at the front there.
It comes and goes, but it's never really gone away.
Sure. So it does look very fungal.
Yeah.
And the Dactocort cream has got some steroid in, which reduces the itch as well. So it's a really good starting point for what you've got. Now, if it's not working, then we can try a different antifungal medicine, and usually that will we'll find something that we can use that works.
Yeah.
And the other thing is to try a slightly stronger steroid just because the area is all a little bit inflamed.
Right.
And I think that that will help settle down the itching side of it.
Yeah.
Sometimes you need to use a tablet of antifungal
Yeah.
to make sure that you're getting on top of it, because sometimes it's tricky to treat. And if it's been there for a long time and cream isn't making it better, then that may be the next stage.
Yep. OK, that sounds all right.
Nice to see you.
OK, thanks.
Great, I hope that works.
Yeah, I'll give it a try.
Bye-bye then.
Thank you.
That is a bit down, your oxygen, compared to what I'd expect it to be. Right, I think what we should do is treat this as an asthma attack. I think we should give you 3 things, yeah? I'm going to give you a spacer, you know, like one of those...
Tommy, get down, please, because you'll hurt yourself, good boy.
If I draw a picture, will you colour it in? What's that?
Dinosaur.
A dinosaur? I know I'm rubbish at art, but it's not that bad.
That's a cat.
OK, you colour it in with that biro, OK?
Mommy, that's a dinosaur.
Oh, that's brilliant. OK, so I'm going to give you a week of steroids, a week of antibiotics. It's OK with the pregnancy. In the meantime, you could also use a bit more of the blue inhaler at a time, which I'll give you. And unfortunately, in pregnancy, fantastic colouring in. Your asthma can get worse.
No.
Thank you very much. Now, can you put the lid back on my pen? And are you going to give me your picture? Thank you. And we'll see you again if that doesn't sort it out.
OK, thank you so much.
That's all right. Bye, boys.
Thank you.
Bye now.
Oh, dear. You still got your cough?
Oh, it's terrible. They said will last 6 weeks, so it's only 3.5 weeks so far. So.
Not that you're counting.
No.
Yes, what can I do for you?
My anxiety is through the roof at the moment. I cry for days. I can't go to the toilet, that's another thing. And when I do, it hurts.
Doing a poo all week?
And I keep getting pains under here and around my back. And you know me, I convince myself it's my heart. Oh, I know, I know. I can't help it. I hate being like this, I really do.
I know.
Sorry.
What are the big stresses you've got at the moment? Apart from your physical thing, what's going on?
Apart from Edward just leaving Bristol, nothing really.
And then her other door's leaving as well.
How far are they're just going. One's going to London, one's gone to Dawlish. I don't know. I phoned 111 the other night, and this guy chatted to me for like half an hour. He was absolutely fantastic. He managed to calm me down, and the pains went. I know I'm probably a waste of time and space and energy, but I just feel. I just want to cry. I don't want to cry. But anxiety is something you can't help. I just can't switch it off and go, oh, it's nothing, and carry on. When I'm sat in a chair crying, I generally feel, you know, this is the end. If I can't get to the toilet, I push so hard that I do get pains under there and around there. So I know it probably is constipation as well. I just feel an idiot now. I'm sat here feeling stupid.
But you've got a problem. But I think your problem's anxiety, really, and fibromyalgia. When you say you're constipated, how many days has that been for?
I couldn't go yesterday. I couldn't go the day before.
Come over here and let me feel your tummy and just have a look at you.
I'm sorry.
OK, so lie yourself back. Do you ever pass any blood or anything?
No.
A little sore there. And over there?
Yeah, that's where I usually get my IBS pain.
OK.
If you find a heartbeat that's not mine, we're in trouble.
So what you've got is very exaggerated bowel sound, so it's going blah, 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 blah in there, you know, it's noisy.
Dr. Robert said when he diagnosed me with irritable bowel.
Is that what he said? Well, it's the same thing. So I think at the moment...
It's not irritable, it's downright nasty.
Yeah, nasty bowel, but it's not dangerous bowel, and I'm sure it's the same thing. And when you get stressed...
It plays up worse?
It plays up.
It's awful.
Do you remember over the years what treatments you've had for anxiety? Did you have cognitive behavioural therapy?
I did. I think that was left once.
If you ever want to try CBT again, we can get you sent back, because in the long run, that's probably going to be the most effective. Go home and just think about this being anxiety and relax. And your children haven't left the planet. They're just doing well and gone.
You've got your grandchildren.
Yeah, yeah. Well, you will get used to it. It just takes a while.
Thank
Okay.
you.
All right. Okay. Bye.
Thank you. Bye-bye. Ronald Trump. So you haven't been up to much in America recently, have you?
No. I phoned the 111 people and they scared the hell out of me by saying, you've got an hour to get to hospital. I was like,
I think by that what they probably meant was your appointment's in an hour, so you've got an hour to get.
And it looks a little bit snotty.
Say, no, I don't.
I have a migraine.
Migraine. I don't know what you call them.
I don't even know how it's spelled, so I'll just leave it there.
Did you see any boats on the canal?
On the canal?
Yeah.
What
like
canal?
In canal.
Hi, what are we talking about?
Right. Basically what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long has it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... Oh, God. I had polio when I was a baby. I was one of the last ones to actually get it and caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take...
you were lucky not to lose the leg?
Yeah, layer of skin from my bum.
Yeah.
It's such a nice bum before as well. But
it's this one that's the problem today?
My foot won't be very clean because...
That's all right, don't worry.
I can't get down.
That's all right, don't worry. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron it gets deposited in the skin, and it can cause usually itching and brown staining. But it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement on my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
That's fine. I've given up the cartwheeling. It's just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.
I'm Dr. Graham. So how can I help today?
I have had a sore throat since Wednesday, and as of yesterday and today, it is raging.
And have you noticed anything else, like a temperature?
Today I probably feel like I've got a bit of a headache and a little bit hot, but then I've had a boozy weekend, so I don't know if it is that.
OK.
So I can't really differentiate between the two at this minute.
And you coughing much?
Not coughing much, no, but if I have had the odd cough, then it really hurts sort of right in there. I can
bring anything up when you cough?
No, I'm not bringing anything up.
OK. And you remind me, do you smoke?
No.
OK. So let's check you over. Take your temperature first.
Open up wide. Put your tongue back in, actually. I'm going to put it down a bit just to look at the throat. OK, that all looks fine. You actually don't have any tonsils to see, which is normal for your age.
Right.
OK, so they disappear as you get older because you don't really need them. Just relax your chin down. And it doesn't look too red, and you've definitely not got any pus or anything. Does that feel sore
really,
under
really
here?
Sore there,
yeah. OK, so that is sore there, but no glands that I can feel. But that is where your glands are, and they probably are sore there because that's... Do you know what your glands are for?
No, I haven't really thought about it, to be fair. But...
so they're where you make white cells. So when you've got a sore throat or any infection, you make more white cells, and that makes the gland get bigger. And often it actually hurts quite a lot, in some ways more than the problem that it's trying to fight. So I think that's the main problem. So I think the most likely thing is that this is a viral sore throat, OK? And that unfortunately it will last probably another at least few more days, maybe even another week.
Right.
You've had it since Wednesday, so it's about day 5 now. And they say that it takes sort of 7 to 14 to clear. And at the moment, I think that you will, you know, you're normally quite well and you will probably clear this yourself. It's a kind of annoying problem where, you know, if I get it, it's not much more I can do apart from take painkillers and wait for it to go.
Okay.
And at the moment, there's no evidence that you've got the kind of infection that will get better quicker with antibiotics.
Right, OK.
Does that make sense?
Yeah, no, that's fine. I just wanted to make sure that there wasn't anything, because it's just been getting worse, so that's fine.
And was there anything else today?
No, that was it. So just plenty of fluids.
Yes.
Right.
Painkillers? Have you tried some painkillers?
I haven't, no, because I just find that sort of stuff doesn't really touch the sides, if I'm honest.
Yeah.
So.
I mean, it's entirely up to you, but lots of other people would take paracetamol or ibuprofen, or even gargling with aspirin. Some people find helpful.
Yeah.
Because it's sort of anti-inflammatory on the actual throat problem.
OK.
But you don't have to take anything.
Yeah. OK. All right, no, that's fine.
Great.
Lovely, thank you.
Is it raining still?
It stopped. Stay that way.
All right then.
Thanks.
Bye now.
Bye.
Where are we to?
I'm not allowed to wave?
No.
Is it against the practice, the surgery rules? Yeah, OK. I'll remember that for next time. No waving, no smiling, no laughing.
Absolutely, yes.
And only compliment the reception staff.
Absolutely.
How you doing anyway?
Oh, just take it easy.
Right, so I'm Dr. McLaren. Nice to meet you.
Yeah, I've managed to slip in the bath, which aggravated my shoulder. And then I was looking out the window and it cracked. And I couldn't move. I was in so much pain. And today it just feels unbelievably tender.
Did you land on your shoulder? Did you land on your hand?
I kind of landed there, but it wasn't too painful.
And then subsequently, this pain just started abruptly when you were doing nothing, and since then it's been really painful. Have you tried any painkillers? Or...
I did yesterday, aspirin and codeine, but I can't really take codeine at work.
What is work for you?
I'm an apprentice plumber.
OK.
So I need my marbles around me.
OK. Is there anything that you were worried you might have done, or...
I'm paranoid it's a rotator cuff because it will take ages to heal. Hopefully you're going to tell me that it's something lovely.
OK, like...
Something that will heal in a couple of weeks.
OK. Well, let's take a look at it to start with.
Yep.
Easier for me with you stood up.
Stood up.
Now turn and face me. OK. I want you to bring your arms slowly up. Touch at the top.
I don't want to.
You stop as soon as it's uncomfortable. So at what stage did that become uncomfortable?
Well, I grunted.
So...
Can I put them down?
Put them down. If you were to do the same forwards...
That's fine.
That's easy. And right the way to the top?
Yeah.
Easy.
Oh, ow, that's
right
new.
At the top.
Yeah.
If you go across there, that looks like it's quite uncomfortable.
It's not nice, but it doesn't hurt anywhere near as much as when my hand was up.
OK, that's it. So you mentioned rotator cuff. It's not entirely typical of that, but I'm not going to be able to say with complete certainty that that's not what it is. This is your shoulder. Your rotator cuff is muscles which support the shoulder, which go over the top of the ball of your shoulder, around the front, around the back. The other thing that you have is ligaments and tendons holding the other structures together. You were quite tender around where your shoulder blade joined your clavicle.
Yeah.
And really quite tender when you had to do that movement forwards, which is putting stress around this area, which makes me think it's probably a soft tissue injury to this area rather than your rotator cuff.
That's cool.
I think either way, I would expect with avoiding heavy lifting.
Like lifting radiators and...
Yeah, exactly.
OK.
Taking ibuprofen regularly. Things should start to improve, certainly over the next couple of weeks. And if you're not making any progress, come back in and see us. OK?
Right. Thank you very much.
Hi, can I help?
I want to make an appointment for Dr. Edge next.
Just the next possible appointment. Yeah.
Is your mum a doctor?
Yeah.
You look so like her.
I know, I hear that a lot.
Lovely.
Hello. Hiya. I did bring my mum down before to have a little test for dementia, and she passed. She's a bit forgetful. Like, things will come out not quite in a proper sentence, like words would be the wrong way round them.
Yeah.
She can get quite argumentative as well, which I know is another sign. If it is the early stages of dementia, I would like to know if she can possibly start taking the tablet that prevents it from coming.
OK. We're quite a long way off that, OK? We'd have to make a diagnosis first, and there's certain things that we'd have to do, but we certainly talk about it.
Yeah.
We'll talk about that now. Is that all right? How long ago was it that you brought her down and she had the test for which she passed?
About a year,
About a year. OK. Do you think that you've got worse since then?
No, not really.
Do you?
Yeah, but not really bad.
You're living on your own? OK. To get a diagnosis of dementia, we ask lots of questions, but lots of us get a little bit forgetful.
Yeah.
But are you functioning OK? For example, are you managing your own money and your
Everything.
shopping and all that kind of thing?
Yeah.
Functioning fine?
Yeah.
So the geriatricians, the elderly experts, would actually say that you need to have both the sort of forgetfulness and all that sort of thing and what we call a functional problems.
Right, OK.
Like not being able to do stuff. OK?
Yeah.
But let me just find the previous...
But he was adamant I was all right. Wasn't he?
Yeah. Yeah, which is good. You think I'm coming down and I want you to have dementia? I don't. I want it to be stopped if you have got it coming.
All right, let's do that same questionnaire again. OK, first thing I'm going to do is I'm going to give you an address. I want you to say it back to me, and then I want you to try and remember it, and I'm going to ask you again in a bit.
To confuse me.
The name and address I'm going to give you is John Brown, 42 West Street, Kensington. Could you repeat that?
John Brown, 42 West Street, Kensington.
OK. Can you tell me the date today?
7th, I believe.
The year?
70.
Excellent. Can you tell me something that's going on in the news at the moment?
All the fighting, the shooting and that, you mean?
What do you mean exactly?
Well...
Who's doing it, Mum?
Oh, sorry, ISIS.
OK. All right, that's fine. Can you remember that name and address for me now?
John Brown, West Street, Kensington.
What number?
Oh, I didn't hear a number. Did you give one? I'm sorry. I didn't hear the number.
I
just
hear the
remembered
number. OK, you clearly remembered it. That's fine. All right. She's not going to fail this. OK, now I'm going to ask you a couple of things, all right?
Yeah.
Compare now to a few years ago. Is she having more trouble remembering stuff that happened recently, like the news and stuff?
No, not the news, per se, but she might put her glasses down and she can't find them.
Find them, all right. Does she forget what you've said to her?
Sometimes, yeah.
OK. Trouble with financial?
No.
Pain? No. OK. Manages her medicines?
Yeah.
I don't think there's any sign here.
That's fantastic.
OK?
Yeah, that's
All
brilliant.
right.
Yeah.
So now I can cuss
No,
her,
you-
can't I?
Yeah, you can tell her.
Keep telling me off now, yeah. No, but it's only because I work with people with dementia. To me, it's like I see little things.
OK, well, let's keep
going
an
on.
eye and you can ask me. But, I mean, so many people get that thing about putting the glasses, you know, I mean...
Easy done, isn't it?
Yeah,
done,
no,
but
yeah,
I'm
but
not
she wasn't
that-
like that before, do you know
Yeah,
what I mean? It might just be old age.
It's just age.
Yeah.
Yeah, I'm 78
I would rather my mum, you know, got old gracefully rather than ending up...
OK. I'm not going to say anything about that.
Nice to see you after so long, though.
Nice to see you, yes.
Yeah.
All right. All right. OK.
Thank you.
All right,
Bye-bye.
OK. All right,
Bye-bye.
then. OK.
Yeah.
Sorry, my key's on the floor.
Oh, that's no good. No, I won't be testing you for your forgetfulness. All right, okay, bye-bye.
How can I help?
My son is here. I can't find him.
What's his date of birth?
Oh, now you're asking. 17 of the 3rd. 02, I think it is. No, it's 23rd, isn't it?
23rd of March.
His sister's 17th.
Okay. Right, what can I do for you?
Well, I came Friday.
Right.
Because I've been got a blob in my eye.
Yeah.
And I went to the eye hospital and he's told me that I've had a stroke.
Right.
My eye aches and my head aches all the time. And I think it's affected my hearing as well, because I hardly hear anything.
Yeah. So how do you feel about what they said?
Well, I was a little bit shocked.
Yeah.
But he said they're referring me to the stroke clinic.
Right, OK. Have you heard from them yet?
Nothing, no.
No. I'll try and chase that up. We'll have a little look at you and then I'll see if I can get through to the stroke clinic now, because you need some blood tests and a full assessment. How long did the problem with the eye last for?
I've still got it.
You've still got it, yeah. OK. Your blood pressure's good, so that's good. Can I just have a little listen to your heart? OK, sometimes it can be an irregular pulse that can cause a clot to travel around and cause the stroke, but at the moment it's nice and regular. Deep breath and out and hold it there. That's fine, OK. Right, so they'll arrange a CT scan in the stroke clinic, OK, to assess your head. What we want to do is reduce your risk of having this again, OK, and try and work out why you had it this time. Do you smoke at all?
Yeah, but I've cut down since.
OK, how much do you normally smoke?
Well, about 10 or 12.
OK, you need to stop.
Yeah.
Yeah? This is a warning.
Yeah.
And luckily, you're good. Yeah? But it could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
OK, what can I do for you?
So, just today, I've had this rash kind of appear. It's quite bumpy.
So, any of these tattoos new?
No,
'Cause
these are
sometimes
all...
you get
these
reactions
are all, like,
to tattoos,
kind of
so...
10 years old.
I agree. It is a little bit lumpy, bumpy skin, isn't it?
And it's just been quite...
But it's interesting because you're lumpy, bumpy in the area of the blue. Actually, let's just look under, getting under some magnification. So, this, I mean, it looks very much like this is some of an allergic response to the ink in the skin, and we do see this from time to time. And usually, it's when somebody's had, you know, a new tattoo or something that's caused it to flare up. But that's not the case with you.
No.
In terms of what we do with this, if it's really troubling you, a mild steroid cream will probably settle it down.
That's good. It just puts my mind at rest. And
So you used to work in one of the churches, is that right?
no, I work in Southmead at the Southmead Development Trust, which is a charity.
Going well?
Yeah, very well. I mean, we're trying.
And last time you came here, you did talk to Dr. Wardock about a vasectomy, did you?
Yes. I think we're ready to take that to the next step.
You are ready, or
Yeah,
you're not
we
ready?
are ready. Having talked about it. So
OK.
I need to. What is the next step for that?
Well, the next step is one of us
Book an appointment.
needs to write a letter, actually,
Okay.
basically, and get you seen. You've got 2 kids? Both in good health?
we got 2. Yeah.
Both in good health?
Oh yeah, absolutely fine. Yeah,
Your wife wants to go ahead with this?
Very lively. Yeah, she does. You know, part of the reason is that we've tried pretty much all the other kind of long-term contraception things, and they've all just been, you know, had side effects and just been a bit unpleasant. So
Richard gave you a leaflet with all the
he did. Yeah. I read that. Looked for all that. Yeah, that was.
So it's your call. I mean, we don't need to deal with it today, but if you
if we can write the letter,
I can write a letter and get you in the system.
That'd be great.
Fine.
Excellent.
Okay, and then the next thing you know is that you'll get a letter with an appointment to go.
Yeah, that'd be fantastic.
To have it done.
Yeah,
take it from there.
Yeah,
Okay.
that'd be fantastic.
Looks like
That's
Richard's
great.
giving you the chat ready.
He has, yeah.
Okay, I'll get that done.
Thank you very
You
much.
sure I'm not pushing you into...
No, absolutely. No, honestly.
Just,
like,
I saw that was the last thing.
I,
It looked like you'd been left hanging.
No, we talked about it. We thought about it for quite a long time, and then kind of just. I think that might have even been before Christmas.
I'll give you a 2-day cooling off period, okay? I'll write a letter next week if I haven't heard back.
That would be fantastic.
All right?
Okay, great.
Okay,
Thank you very much.
Bye.
You all right? Your pain in your head?
Yeah, it's all there.
Okay.
In the backs of my eyes.
I'll see if I can get through to the stroke clinic now. Oh, hi, I wonder if you could help me. I've got a patient with me who presented to us on Friday with eye symptoms, loss of central vision, and she was referred to the eye hospital. I mean, she needs to be seen today, really, doesn't she, if she's got ongoing symptoms? So shall I wait to do anything until you bring me back? Right, she's just going to check with the consultant.
I got a pain in this eye, and I'm worried to death I'm going to get another blob.
What's the one thing you can do?
Stop smoking.
Yeah. From now?
Yeah.
Yeah. Because that's the biggest risk.
Yeah. What causes blood clots, Sam?
So, as I said, one of the commonest ones are an irregular pulse. Another one is narrowing of arteries in the neck. That can throw off a little clot, and that can go to the brain as well. So what they'll probably do at some point is arrange a monitor to monitor your pulse over a week or so to check to see if that happens. And also they'll probably scan your neck to check there's no sign of any blockage there as well. Okay, and they'll probably arrange a CT scan or an MRI of your head as well.
Yeah.
Okay. A stroke is potentially life-threatening, so it's very important to act quickly if anybody's got the symptoms of a stroke. A way of identifying that is by using the word fast. So the F is for the face, if there's any facial drooping. A is for the arms. Can people raise the arms above the head? S is for slurred speech. And T is for time, acting quickly by calling 999. Hello, Amanda Ramshaw. But as she's got ongoing symptoms, I'm concerned, to be honest. Just thought the guidelines say that we need to send people in. But yeah, so the options are we either send you to the emergency department today, or we can arrange for it to be seen in clinic tomorrow by the stroke consultant.
Yeah, I'll go tomorrow.
You'll go tomorrow, is it? Okay, all right. Yep, she says she'd rather do that tomorrow. Okay, bye-bye. Right, okay. So I'll send this off now. It says all patients should have 300 milligrams of aspirin, okay?
Right.
And you mustn't drive.
Right, okay.
If you don't hear anything by lunchtime tomorrow, let us know.
Okay.
All right.
Yeah, thank you very much.
If you want to make an appointment for the smoking clinic, please do.
Okay.
All right. Okay, good luck.
Thank you.
Bye-bye.
Bye.
Oh, my love, take care. Bye.
Come on through. Hello.
Hiya.
Come on in, come and take a seat. I'm Dr. Ahmed. So, Murath, you had a accident. You were knocked off your bike. Did you go to A&E when that happened?
I went to A&E, and after A&E, we came here.
Yes, you saw Dr. Pelly. You had cocodamol and naproxen given because you've got a dislocated little finger.
This is not the problem while you were down there.
OK, that's all right. I just want to get the background
Yeah.
first as well. And what's happening now with the finger or with the plastics team?
Finger is same. I got pain on my shoulder, really pain. And since Sunday, I haven't been eating. So I haven't been eating nothing. That's
You haven't kept nothing down since Monday.
Yeah, then when I go to toilet, it's just water comes out.
OK.
And I have really bad pain in my spine in here.
In your lower back?
Since the accident happened, my body changed. I don't know what happened.
How did you come off your bike?
The 26-ton of truck hit me off my bike. I nearly died. I nearly went underneath.
But you didn't hit your stomach
No,
or anything like that?
last week.
So it was a close thing.
But someone said I might lose my belly button because I was so frightened. Belly button moved.
You listened to too many stories.
OK.
I talked to my mum
All
back home in Turkey. That's what she said. But yesterday, someone told me if you're puking up, you could have stomach cancer. That makes me more
How are things going with your breathing then? How are you
At the moment, things are good.
Yeah. Did you do the pulmonary rehab then in March, it says here?
I went along to the actual appointment. My blood pressure was so high. I mean, I did warn them that I'd been kicked out of gyms before because of my blood pressure being so high. And it's not that. I had a reaction to the sulfites. I mean, sulfites are the worst to give me.
Right.
And I don't care what anyone says. I am allergic to them. I mean, the alcohol, it's the sodium sulfite in it, which is a confirmed allergy with me. They sterilise the equipment. And that is what I'm reacting to in the alcohol. And they put it in eye drops, ear drops. I mean, it's like I have no access to any pain relief because if I'm in pain, they tell me to take paracetamol, which contains sodium sulfite. So I have no pain relief, which is why I kick off so much.
So you're only taking the one inhaler then?
Yeah.
So
I can't tolerate the lactose if you have any more than that.
Okay.
Because I'm lactose intolerant.
Yeah, saw that one. But you haven't had to have any oral steroids in the last year?
Well, the last time they gave me steroids, they nearly shut my lungs down. And that's the maize starch in it.
Yeah.
And with the maize starch, when the manufacturers manufacture it, they put a sulfite in it.
Right, let's do your blood pressure. (146/82).
Good, it's back down again.
So, I'll get this ready. And you remember how to use this? Blow, but then you keep... Right, when you're ready, a nice big breath. Well done, take a seat with it. Let me write it all down. Let's have a look. Yeah, so we don't need to change anything. Right, but I will refer you to the pulmonary rehab. So that's our plan. Is that all right?
Yep, that's fine. That's fine by me.
Lovely. And I'll see you hopefully in a year's time.
OK, I'll see you in a year's time. Bye.
Bye.
Someone told me if you puking up, you could have stomach cancer.
That's made you very worried about it. OK, so let's check you over. OK. And do you feel sick in between these vomiting episodes?
Yeah,
as if...
I feel sick.
I know he's quite poorly because he can't even smoke a whole cigarette.
There's always some good thing out of a bad thing. Are you able to just lie down on the couch?
Yeah.
OK.
There.
There's generally a bit all over, isn't it? Yeah. OK, come and take a seat. So look, I'm sorry that you had this accident from your bike, but
I think it's separate.
It could have been a lot worse.
Yeah.
This is a separate issue. You're right. I mean, I think you've got a bit of... there's a lot of it going around, actually, this week. There's a viral gastroenteritis or a bug that's causing a bit of sickness, a bit of vomiting, a bit of loose poos. So we can give some tablets to help with the gripey pains and just drink fluids. But I would stop the naproxen. It probably aggravates...
I don't have cancer or nothing.
No. There's no symptoms of any cancer.
OK.
OK. If anything gets worse, you know where we are, or changes, but this should settle things.
Well,
I'll give you that. All right?
Thank you very much.
That's all right. Take care for now.
Thank you.
Right, how can I help you?
Can I have some batteries?
Oh, is that what you wanted? I could do that. Easy. 1 or 2 hearing aids, Mr. Dunn?
3.
3. And one in the middle.
What can we do for you today?
Well, it's my ears, doctor. For some months now, I've been getting like a buzzing. And a couple of weeks ago, I went all strange. I nearly passed out and I was sick. And then yesterday, the buzzing in my ear was so horrendous, it was awful. It was like it was full up with something, you know, sort of like blocked.
Have you noticed any difficulty in hearing?
I did yesterday. I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me? When people get buzzing in the ear, it drives them mad.
Last night it did.
Kept you awake?
Did last night. I went to bed. I find that I've got noise going on in the house all day because then that takes it away. I've got the telly
that's
going.
Very interesting. You've hit on the solution, almost.
Oh, right.
Have you ever been exposed to loud noise? Never worked in a very noisy environment?
Dry cleaners is about as
No.
noisy as it gets.
You're not addicted to going to awful loud concerts?
No,
and,
nothing
okay.
like that.
All right.
No. A bit old for that now.
Tell me if I hurt. Well, your ears are as clean as a whistle, I tell you. You don't need them syringing. That isn't the problem, whatever the problem is. Same with that one. Very good. Tuning fork. Can you hear that? If I put it there, can you hear it?
Yeah.
Good. Same thing. You hear that?
Yeah.
A bit louder there. Or there.
There.
Good. That's how it should be. What I'm going to do is call out some numbers to you. Just call them back.
Okay.
So if you put a finger in one ear, all right? 62.
62.
32.
32.
Thank you. Other ear. 78.
78.
14.
14.
That's fine. I can't find anything wrong with your ears. But, you know, you don't get the buzzing for no reason whatsoever.
No.
If things change, then we should see you again and do something about it.
You've disappointed my children now, you know that, don't you?
Because?
They think I'm all gone deaf.
How do they know? How do they know? We've proved you're not going deaf.
Oh, Mum's going deaf. They
don't want you to. Well, they don't want to get you to age before your time. All right.
Right. Oh. Thank you very much, Doctor.
Good.
Nice
Bye-bye.
to meet you. Bye.
Nice to see you. You gonna give me a wave? See you later. Goodbye.
All right,
Cheers
thank
then.
you.
Bye.
Right, that's lovely.
Very good.
Thank
nice
you.
to see you, Tracy.
Okay.
See you in 2 years.
Yeah,
Or
probably.
sooner.
Yeah. Bye-bye.
Take care for now.
Thank you very much.
That's all right.
Have a nice evening.
Thanks. Bye-bye.
Bye-bye. Come on in. Hiya.
Yeah, hi.
So what's been going on then?
I just, last couple of weeks, I just get really bad headaches.
Oh dear.
And this morning I woke up with a really bad one.
Right.
This morning.
And what's been causing them, do you think?
I don't know, but I'm on tablets for...
He's got ADHD and he's on concerto, which is on quite a high dose.
Right.
But at the moment, it's hurting his eyes as well, and underneath his eyes and all down here.
Right. Whereabouts in your head are they?
Just like, just all over.
All over. And,
Yeah.
And it's been there for 2 weeks on and off, or is it there all the time, or what's it
Like,
like?
sometimes at school, like if I'm reading or I'm looking at the board, like for a lesson,
Yeah.
it hurts. Or like sometimes before football, if I'm hot, or I get them like randomly sometimes.
Okay, so when it's hot, it's worse. When you're reading, it's worse.
Yes.
It's been on and off in the last 2
Yeah.
weeks, and before that?
You've had them for a while. I've had them for a while since I've been on my tablets, but I don't know if it's my tablets or not.
How long have you been on your tablets?
A couple of years.
Oh, I see. So you've actually had headache for a couple of years
Yeah.
linked to the tablets. It's just it's been worse in the last.
It's worse, but the last fortnight has been really complaining a lot.
Right then. So you're going to Nepal, is that
Yeah,
correct? Yeah. Okay, and going for 2 weeks.
Yep.
Volunteering, yeah.
Mhm.
And what exactly are you going to be doing?
I'm renovating a school.
Oh, okay,
Yeah.
fantastic. So you said already that you need your tetanus and typhoid. Also hepatitis A, you need to be careful. So we'll quickly have a look through. It might be easy if you come round
Okay.
a little bit. So the hepatitis A is spread through food and water and shellfish, you
yeah.
see, and person-to-person contact. And then typhoid, food and drink again, tends to be food and drink and hygiene, personal hygiene. And rabies, obviously. Any stray animals resist the urge to stroke
Yeah.
them. Even if you get a scratch or a bite, do go and get checked immediately. Make sure
Okay.
you're okay. You happy to have your injections today?
Yeah.
Allergic to anything? No. No chance of being pregnant? No. Not breastfeeding? No. Lovely. OK, we've checked all our safety questions. I just need to take your coat off so I can put it in your arm. If you've got any queries or your things change, you can look on a website called Fit for Travel. Okay. It's like the sister site of what we looked at. OK. So it's got the same maps and everything on there. OK, all right. Cool. So this is the hepatitis A, OK? Sharp scratch. There we go. Right, sharp scratch. Right, and that's your typhoid. Make sure you're not bleeding. Right, come around the other side, and this will be the triple one. So, sharp scratch. All done.
Have you got any other symptoms going on?
No.
No weakness or numbness? Your arms and legs are working normally?
They're a bit achy today because I played football yesterday.
He was in a tournament yesterday,
Oh, all right.
so
Did
he
you
played
win?
football all day.
Oh, no. We lost
No.
in the quarterfinals.
Oh, that's a shame. Never mind. Put your arms out like that. Close your eyes. Squeeze my fingers. Pull me towards you. That's it. Well done. Push me away now. You can open your eyes now. Push, 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 push. That's great. Have a seat. I want you to follow my finger. Just no double vision at all.
No.
That's good. Can you feel me touching you here?
Yep.
All feels normal. Open your eyes really wide. Close them really tight. Show me your teeth. Blow your cheeks out. Give me a cough. Shrug your shoulders. Stick your tongue out. That's right. I'm just checking all the nerves to make sure they're all working okay. Right, I'm just going to shine this light in your eyes. Lovely. That all looks nice and normal. You said your vision's okay?
I can't read, like, so far, like, I can't...
Oh, I see. So it is a bit blurry on far vision.
We put it first down to the medication.
Yeah, well, of course, those tablets might be the culprit, mightn't they?
Yeah.
OK, well, I think I want you to have an eye test. And I want to reassure you that examining you, it's all completely normal.
Yeah.
So I don't think that there's anything more serious going on underlying all of this. I think probably it will be that the eyes are the culprit and that's the trigger. Have you got any painkillers? Have you tried anything to help?
Painkillers help.
We take paracetamol, as usually I give him.
OK, because it may be worth trying some ibuprofen on top and we'll just
Okay.
see what that's doing and then I'm going to get you back in to see Dr. Bolam next week.
Okay.
But if things get worse, then we'll see you again.
Okay, well, I'll go and book his eye test now. Thank you ever so much. What did you say,
Bye
Logan?
Thank you.
Good boy, bye.
Melissa Sargent. Hello, hi there, come on in.
How are you?
Very good, thanks. Come and have a seat here if that's all right. It's a little bit sort of crammed. Is that all right? What can I do for you?
So basically, I have a IUD inserted. It's been in for about 2 years, but I've been getting really bad cramps and pain when I'm having like sex. I can feel it in the top of my like cervix, and my period's been ongoing for about 2 months now. So it was about a week ago that I started feeling pain there.
Okay. What I wonder is, has it moved?
Yeah.
Has it come down a bit? Do you feel like it might have done? Is that what you had in mind?
Yeah, because I'm not sure what else could kind of... I'm normally really regular with my period.
So what I'm going to do is see if it's sitting down in the neck of the womb.
Okay, sure.
Not terribly pleasant, but it's not terrible. So I'm going to get you over lying on here, and you're going to need to take all your bottom things off, I'm afraid. But it's warm today, so that's not,
it's
not a freezing day. So what I've got is the speculum, you know that
thing they used to put it in,
and I've also got some swabs, because sometimes funny bleeding can be caused by an infection.
Yeah, okay.
So I'll just check you for chlamydia whilst we're about it. And if there's any discharge, I'll take this swab as well. So it's a couple of swabs. Oh, so bend your knees up for me. Is that all right? First thing I'm going to do is I'm just going to feel the womb and see how everything is in there. Just relax a bit there, take some deep breaths. That's great, well done. That's all. OK. How's that? Yeah, sorry. You can get up and go, you all right?
Yeah.
Very good. If you like to get up and get dressed. So, 2 possibilities, well, 3 actually, I suppose, that we have to think about.
Okay.
One is that you got pregnant. I don't think this is likely to be the case with the coil in, and it's causing funny bleeding. So I think we should do a pregnancy test.
Okay.
The next is that the coil has slipped.
Yeah.
And that actually we'll have to take it out. And then the third is that you've picked up an infection of some sort that's causing it all to be sore.
Okay.
The question is really, are you sexually active?
Yeah.
Because if you are, and not using condoms, that is always a possibility.
I've had the same boyfriend for like more than a year now.
Yeah, so it's very unlikely.
Yeah.
The coil's a good option for Melissa because once it's fitted, it's sitting there doing its work without Melissa having to do anything about it. And this makes it much safer than other sorts of contraception, such as the pill that you have to remember to take every day, because however good you are at that, sometimes you're going to forget. The coil might not be for everyone. For example, if you have more than one sexual partner, you will be exposed to sexually transmitted diseases, and the coil can transmit those diseases up inside the uterus and into the tubes and increase your risks at a later date of infertility or of pelvic inflammatory disease. And then we're going to need to see you again in a couple of days' time, probably. Is that all right?
Yeah, no, of course.
Callum Chick, please. Hi, Callum.
Hi.
Yes, obviously I've seen you before, so I sort of scooped you out there because I know a bit about what's going on. But we're not really getting on top of this, are we?
No.
When did this start? How long ago did this all start now?
Oh,
it's been going on
probably
for...
about 3 weeks,
Yeah.
maybe.
And you had a definite water infection at one point, didn't you?
Mm.
Yeah? And you had the right antibiotics and you took the full course?
Yeah. My mum says she thinks it might be a kidney stone.
Two thoughts about that, OK? The one is you definitely did have a urine infection 2 weeks ago. You had bacteria in your urine, which isn't a stone, OK?
Yeah.
A kidney stone tends to just give you blood in your urine. I have got blood in your urine, but you've also got white blood cells and you did have bugs, bacteria, OK? So the question for now is whether we treat you with antibiotics, whether you start them now or whether you want to wait and see what your symptoms do and wait for the result.
I could wait till Monday, just maybe take paracetamol.
I mean, I could give you the prescription in case it gets really bad over the weekend, but you don't take them unless it gets really bad.
I think that might be better.
I think what we might do, get you to have a scan of your kidneys, just to make sure that there's no underlying problem causing you to get recurrent infection.
We haven't really had a working toilet for a while, like a month.
You haven't had a working toilet? How have you survived without a toilet?
Just buckets.
Buckets?
Yeah, we just have to get the water and flush it.
Oh, I see. Oh, I see. So you're peeing and pooing in the toilet?
We only just got it fixed like a couple of days ago.
That's all right.
No, so it's not unsanitary.
No, that's not unsanitary. No, that's all right. That's OK. It's only the flush that's not well. I thought you were
Yeah.
going in your garden.
Yeah, no.
I know. OK, so just keep that and don't use it unless your symptoms get worse. Yeah?
Thank you.
OK. All right, any questions you want to ask me?
Just maybe cutting on my drinking. How would I cut down on my drinking?
Do you want to come back down and sit down for a minute? How much are you drinking?
I drink a lot, but I'm not drinking like 2 bottles of wine a night or something. It's just like the most I think is probably about 24, but that was about over like 4 days, 5 days. So.
24 what?
Pints.
Pints of what?
Beer.
Pints of beer. So you drink beer, that's pretty much all you drink. You don't drink wine or spirits?
No, like if I go out in town or whatever, I will, but I hardly go into town. It's just to the pub.
OK. So in a typical week, how many nights do you go to the pub?
I go on Wednesday, I'm going out tonight, and then probably end up going maybe Saturday or Sunday.
So sort of 3 or 4 nights a week in the pub?
Yeah.
Is that right?
Yeah.
And how many pints?
2 or 3.
2 or 3 pints?
On a...
3 or 4 times a week?
Yeah.
Healthy drinking is a really important part of our social fabric, and people need to enjoy alcohol, but enjoy it responsibly. If a teenager gets into the habit of drinking heavily, if they continue this into their older adulthood, this will lead to problems with their general health. So people need to think about their drinking habits and try and establish good drinking habits from early on. So that's 6 units. 6 also, so that's 24. So you are drinking more than the recommended amount at your basic, OK? Is it causing you any problems? Do you feel terrible in the mornings? Do you feel guilty about it? No violence between you and your girlfriend or anything like that?
Do you think it's a problem?
Now I am, but before I didn't.
If you're recognising it as a problem, it's, from what I'm hearing from you, you can cut down. It's not out of control. You have some nights off. You have several nights off a week.
I can cut down. It's just like things like parties and going to see my granddad.
Why don't you try and go to the pubs like often? Why don't you talk to your granddad about him having something else in that isn't beer?
Yeah.
You go to your granddad and have a cup of tea? Sort of strategies like that, isn't it? Or just having shandies, or is that too...
No, I can drink shandies.
Yeah? Well, if you drink shandies, you halve your intake.
Okay.
All right?
I can do that.
Is that all right?
Yeah, that's
okay.
fine.
You come back and talk to me again if you want to.
Okay.
Or Dr. Graham. Okay? Is that okay? There is services that we can offer to help you, but I'm not sure you need that right now.
Okay.
Okay?
Yeah.
Is that okay with you?
Yeah.
Yeah.
Okay, thank you.
All right.
Good morning.
I've got an appointment at 10 too.
Okay. Who are you seeing?
I don't know, my mum made the appointment.
Okay. Is it a doctor or a nurse? Do you know?
I think a doctor.
Doctor. And your name is?
Francesca Clark.
Okay, let's have a look. Yeah, it's the duty doctor, Dr. McLaren.
Okay.
Yeah, I've booked you in, so if you take a seat, I'll call you in.
Come in, have a seat.
Thank you.
What's been happening?
So I was just taking a drink and I felt it was like a bit weird when I swallowed. No, this was a few days ago, but I only managed to get here today because I had to go down to Plymouth to take an exam.
Okay.
But it's just really swollen.
Okay.
And gross.
So 3 days ago, sore throat, swollen.
Yeah.
And gross.
Yeah.
Okay. How do you feel? Do you feel today? Do you feel like you got fever at all?
I don't think I have a fever. I just.
Are these from this summer?
No, they're from last summer. I've been really boring this year.
You and me both. I've not done much. 37.5.
I'm just going to Spain tomorrow or
Oh, yeah?
tonight. Yeah.
Nice.
So the rest of my family are already there.
Okay, head back on that. Oh, yeah. Yeah, they are gross, aren't they? Oh, I think you might have a bit of an abscess going on there. It looks like it's possibly. I'm going to get the doctor to come and look at that because I've not seen one like that before. Okay. And I've looked at a lot of gross tonsils.
Yeah.
I'm going to ask Dr. Cordell to come and have a look.
So I've been documenting it. So that's it, like, last night.
Oh, right,
when it
okay.
started.
Let me try and take a photo again for you.
Yeah.
I'm on pen touch and you've got another one. Especially if you're going away tomorrow. Deep breath in. Yes, you can't really see it very well, but it's this bit here that I'm worried about.
Poking out the back.
Hi, Lizzie. Sorry, I get you've been trying to get hold of me.
That's all right. Okay, I just want you to look at this tonsil because I was just saying, I've looked at a million tonsils and I know what a bad one looks like, but I've not actually ever seen one that looks like this. To me, it looks like it's sort of like burst open or something.
Okay, doke.
Doesn't look quite right. The only reason she's here is because she's going on holiday tomorrow to meet her parents in Spain, so that's why she's here.
It does look horrible, doesn't it? So we need to swab that.
Okay.
Okay. You get that appearance with bacterial tonsillitis. You can get that appearance with glandular fever, actually. But
It's a bit swollen there. But not too sore.
Yeah, you have got a gland up there, haven't you? And then let's have you...
Deep breath in.
Wait for Lizzie to finish it.
You are so good at this. Oh, my neck.
Brilliant, actually.
Oh, I just smell them.
Yeah, it
let's
does.
get with you, isn't
Great.
it? Yeah. So, of course, penicillin, and then because you have got quite a big gland up here, actually, book an appointment to see us once you're back, and we'll just check that that's going down and your tonsils are looking lovely rather than manky. Okay. Is that all right? Does that
Yeah,
make
that's
sense?
fine, thank
you happy
you.
with that?
Yeah, that's great.
Super. Can I go?
Yeah.
In the middle of a cup of tea when you called me out urgently. So I'm going to return to my cup of tea.
Okay.
Okay, have a good holiday.
Thank you very much. Okay, so I just need to get this signed. So if you have a seat in the waiting room, and I'll pass this back out to you. Have a good holiday.
Thank you.
Bye.
This morning, can I help? Do you know who you're seeing?
Dr. Barnett.
Dr. Barnett. And your name is?
Asley Williams.
It's the 15th of June.
What is it today?
It's the 7th.
Okay.
Or is it the 8th? No, it's the 8th today. The 8th.
So it's the same time, but next week?
Next week, next
Okay.
Thursday.
Cool.
Thank you. We'll see you then.
Come on in. Hi.
Hi.
Who have you brought with you?
My old dear.
All right.
Lovely way to be.
Yeah. Hiya.
Hello.
So what's been going on then?
I just don't feel like myself. I feel like doing some stupid things.
Stupid things?
I feel depressed, sort of thing. Like, I don't feel normal. And it's been affecting everyone in the house. And yeah, I just need help, basically.
Yeah, I'm sure. Tell me a little bit more.
Okay, so I don't know what to say. Like,
it's been going on since you were 15, really, hasn't it?
Yeah.
Okay.
Especially with the anger issues.
Yeah. Has anything changed? Has anything brought you down?
I feel like in my house, I'm just not wanted by anyone. I'm just on my own, sort of thing. Like, everyone's against me. I try to control my anger, as Mum said about like getting some wood and about gardening, get some nails, and just every time you get angry, just beat up the wood with some nails.
Yeah.
But that didn't even work because I get too angry and I black out, and then I just ended up punching it with my fists.
I'm sorry to hear all of this.
I just think about things over and over again.
What sorts of things do you think about?
Mum, like, don't love me. My dad, sisters.
Are they the people that are at home with you? Who's at home? Yes, you're living at home at the moment. Yeah. And are those thoughts about feeling low, are they there all the time, or are they just there at certain points?
It's been there. It's there. Like, I do feel low. Something happened yesterday, and it's just completely like, I didn't want to be here yesterday. I wanted to kill myself yesterday.
Right.
I didn't like.
What happened yesterday?
I might explain it.
It's not for me to explain.
Come on in, come and take a seat. Right. What's on your mind?
I'm really stressed out and I get anxiety a lot because sometimes I just feel like life is always going against me and that everything is going wrong and that I feel powerless because I can't change anything.
What year are you in?
7.
Year 7. And everything okay in your sort of friendship groups and things like that?
Yeah, friendship group's pretty good. It's just my home life, which is kind of, like, weird, I guess. Because I live with my mum and my stepdad and my sister and my autistic little brother, Dexter.
And how do you find him?
He's really nice, but he's quite hard to cope with sometimes because he's so high demanding.
Okay.
And I worry for, like, my mum and other people. And sometimes I feel like with their stress, they sort of don't mean to, but they bring it into the house. And people snap at each other.
Yeah. There's been quite a lot of things going on at home.
Yeah.
Really a lot, yeah.
And you've had quite a lot to deal with, haven't you? Because there have been health issues in the family, which is adding to all of this. And that's what I think we need to also explore, is how your response to all of these other issues that have been going on. In terms of when you say that you feel a bit low or a bit anxious, have you self-harmed in any way at all or anything like that?
No. But when I'm really, really upset and feel like I have no one to turn to, I think it's more the thought of disappearing and not being there rather than actually killing myself.
And what's been really great is the way you've told me your symptoms. You're actually very clear in how you're feeling, what you need help with, and what we're all here to do is help support you. So counselling at school would be really helpful because that's somebody who sees you regularly in your environment, you know, on a regular basis. I can see if we can get back into having a few sessions via CAMS, but it's getting increasingly hard to get referrals in, but leave that with me. You might find it helpful to just keep a diary, a journal, and just write down your thoughts. What's made you happy? What's made you sad? And what can you do about it? It just helps to clear the thoughts a bit. Does that make sense?
Yeah.
I'd like to see you back in a couple of weeks and see how that diary's going and how you're feeling.
That's cool. Thank you.
Good. Nice to see you, Archie.
Thank
Take
you.
care.
Thank you.
All right. Bye-bye for now.
Okay. I thought that went good.
She's so lovely.
I know.
What happened yesterday?
Yesterday, we had a major row.
I'm sorry that it's upsetting. Would you like a tissue?
Yeah.
So, sometimes these things are really difficult to talk about, aren't they?
Yeah.
What, can you tell me more about what happened yesterday? You said that you didn't want to be here and that you were even thinking about harming or killing yourself.
Yeah, it's just that I tried talking to people and like people just shout at me, and then again anger comes out, and I don't like being angry.
Let's just start at the beginning in terms of the the things to be worried about. You mentioned that you were feeling really bad yesterday and you got to a stage of worrying about whether you wanted to harm yourself. You said even kill yourself.
Yeah.
Are they thoughts that you've been having that we need to take seriously, or was that just something that happened yesterday and it's, you know, tell me more about that side of things.
Well, I've tried it before.
You've tried it before?
I've tried overdosing, but obviously I've took so many and I've just eventually got drowsy and just dozed off.
Right.
So I just fell asleep, so I couldn't,
When was that?
Oh, it was a couple of months, a year ago, 2 years ago, something like that, yeah.
But you didn't talk to anybody about that?
It's the first time I spoke to someone about everything.
And then, do you think that is that at risk of happening again?
If I get too low, then yeah.
If you got to that stage and you were making plans or you were actively wanting to die, then that becomes an emergency that you need to talk to the crisis team for, and there's a special number that you can talk to get hold of the emergency mental health team.
Okay.
I'm right in thinking that that's not what's needed now, though?
It's not got that far.
No.
It's not got to the point where I'm
Sure. Suicide is the biggest killer of people under the age of 35, and men are 3 times more likely to kill themselves. I think for all of us, it's a normal part of being a human being to wonder what we're doing here and to have existentialist ideas that mean that sometimes we wish we weren't. Of course, sometimes those feelings can spill over into being more serious suicidal thoughts. And if they do occur and are more deep-seated and pervasive, then it's really important that people go and see their doctor to start the ball rolling to get the support that they need. The crisis team, as I say, is the first number that I'm going to give you, and that's for if you get to a stage where you get that bad again. And there's also the Samaritans. I don't know if you've heard of them.
Yeah, I have.
They're a professional talking service. So for people who are feeling so alone that they need to talk to somebody, and that's what they're there for, 24 hours a day. Okay, so there's always options of people to talk to.
Yeah.
And as long as you're able to do that, then that is going to make me feel safe about letting you go home at this point. Okay. Is that okay from that emergency side of things? I'm going to give you some information about some counselling services that includes anger management courses and some CBT, which is about looking at new ways of thinking to try and help you move forwards with some of these issues. The most important thing is if you're feeling worried or you feel like you're not being safe, then please do something about it and talk to your mum about it, because obviously she's heard all this stuff and is going to be there to support you with this, and we'll move things forward step by step, all right? Cheers, then.
Thank you very much.
Nice to see you. Okay, nice to see you.
Take care.
All right, any problems, you just let us
Chair
know.
back.
That's fine, I'll sort it out in a minute.
Hello, can I help?
I cut my finger last night. I wondered if it's more of a doctor's job or maybe a small hospital job.
Can do stitches here. Do you think it needs stitches?
See, I'm not a medical professional. Do you know anything about this?
No, I'm not medically trained either.
No.
I don't do blood, I don't do me.
Okay, I won't get out then.
Do you want to pop into the treatment room? There's a reception in there, so the receptionist in there is probably more able to sort of to see whether you just need it dressed properly or whether you need to go to A&E.
That's great. Can I just walk in?
Yeah, just go on in,
Fantastic.
all right?
Come on in, have a seat. How are you doing?
I'm okay, yeah.
All right.
The British Wellbeing Therapy rung me.
Yes.
And said to talk to you about mood stabilisers.
So you saw them, I think since then you've had some one-to-one. Is that right, or you haven't yet?
I'm still on the list for the talking therapy.
Yeah.
But they can only help with the low moods. They can't help with the high moods.
Right. So in general, GPs don't initiate mood stabilisers. You go and see a psychiatrist or a mental health practitioner to have a fuller assessment to see whether there is a diagnosis that would mean that you would benefit from a mood stabiliser. Do you know what kinds of diagnoses they're thinking of?
They didn't really say.
And how much of the time do you think it is the low mood that's the issue?
It's kind of hard because if I'm... It's obviously like really, really low or it's really amazing, and when I get in that really good mood, I feel like I don't need any help at all, and I don't need anything.
Yeah.
But then when I go low, I think, why didn't I accept any help?
And when you feel absolutely fine and, you know, better than fine, can you describe it a bit?
I'm either really irritable. I don't sleep. I feel like I have like 1,000 thoughts in my brain, but they're not like bad thoughts.
Yeah.
They're like really amazing thoughts, and I just feel really good about myself. I'm great and I want to socialise constantly with people.
Okay.
Because normally I'm quite self-conscious. Like if I'm in a low mood, I'd be really self-conscious, have really low self-esteem.
And how often does that switch?
The low moods last longer. So they'll last longer than a week. So it'd be like more like 2 weeks. Sometimes I've had it like a month. And then the higher moods can last, I'd say, about 2 weeks as well.
Okay. And have you looked it up and thought about what this might be?
I was thinking maybe bipolar.
Okay. Well, what I suggest we do is I'll write a referral letter to the community mental health team to ask them to do an assessment to see whether they think you have got a diagnosis that would be suitable for you to go on a mood stabiliser, as the Bristol Wellbeing Therapy Service have suggested. And I think whilst you're waiting for that appointment, it would be a good idea for you to write a diary of how your moods are, because it's quite useful, I think, for them to see how much it fluctuates.
Yeah.
Okay?
Yeah.
And you could also write down some of the thoughts you've got, okay?
Okay.
Whether they be low thoughts or high thoughts, yeah? And then that will give them a really good picture when you go to see them, okay?
Yeah.
You know, it may well be that both you and the Bristol Wellbeing Therapy Service are right and that you would benefit from a mood stabiliser. What are your views about going on a medication?
I've always been really against it, but I think recently when I've been in a low mood, I've sort of been like, it's not a way to live. Like, if I could help myself to just be stable, then I would prefer that.
Yeah, okay. So, so I'll get on with that.
Okay, thank you very much.
That's all right. Bye-bye now.
Bye.
Hi, have a seat. Hi. Right, what can I do for you?
Basically, I flew home this morning from Spain.
Right.
I come in about 12, and all I can remember was I stood up and I completely blacked out, and my mum said I collapsed on the floor, smashed my head on the patio thing, and I don't remember falling. I just remember waking up 2 minutes after, and she was like, "Am I right?"
Okay. So that was 12 lunchtime today?
That was kind of when, no, it probably would have been more around 2 o'clock that it actually happened.
Okay, and how have you been? You've been in Spain, yeah? And have you been eating and drinking normally?
I ate on the plane.
Yeah.
And I've drank, yeah. So,
yeah. Fine, okay. And have you drunk much alcohol when you've been away?
I drank about 3 nights in the 12 days, not every day or nothing.
Right, okay. And did you have much last night?
I didn't drink last night.
No, okay. Have you used any drugs or anything? No, okay. Fine. Can we have a little look at you? Is that okay? Okay, so I'll just check your temperature. That's okay. Can I pop this on? Well, that's going up. I'll have a little listen to your heart and your chest, if that's okay.
I feel like my heart's beating really fast as well.
Do you? Okay. Just a little feel of your pulse. Okay, it is beating a bit fast, actually. And how long's that been for?
Since I dropped.
Right. Just have a little listen to your heart. Okay. What I'd like to do is get you to stand up, wait a minute, and then repeat your blood pressure with you standing, if that's okay. All right, so if you stand up. Okay, that's okay.
I'll sit back down now.
Yeah. Okay. Your heart rate is still quite fast. So what I'd like to do is get an ECG, a heart tracing. So if you go and have a seat in the waiting room, I'll ask one of the nurses to do that for me, and then we'll review the ECG and see where we'll go from there.
I'm Dr. Jewel. Hello.
Hi, nice to meet you.
What can I do for you?
During December, I had a really bad acne, so doctors prescribed me with this solution, and I've run out, so basically I needed more.
Okay. Did it work? Does it do the trick?
Yeah.
So you're happy with that?
Yeah.
And all you want is for me to re-prescribe it? Okay. Somebody's looking after your diabetes, and is it well controlled and you're on top of it and
yeah.
you know what to do? How long have you had that for?
I think since year 9, so around about 2012.
You cope with the restrictions and everything?
Kind of.
You have to live with it. You have to live with it as best you can. So what about the PCOS?
The doctors weren't sure if I was being diagnosed with it or not because they were unclear during my scans. And then they didn't really say much about it after that, so I just stopped. So I just assumed that I don't have it.
But unfortunately, they think you have.
Yeah.
Do you understand what it is?
Not really.
No, neither do I.
I kind of have a...
Nobody knows what it is. We know some of the effects of it, but nobody knows quite what the underlying problem is for PCO. It contributes maybe to you being a bit overweight, which makes the diabetes more troublesome, I guess. And it makes your periods be a bit irregular. Now, we don't mind your periods being irregular and scanty. Do you?
Not really, no.
Good. It's associated with a problem of fertility.
Oh, yeah, I kind of had an idea of that.
So do you have any feelings about that?
Kind of. Well, not now, obviously, but... yeah, I do.
No, but I mean, it might be something that you worry about in the future. There's no way of telling you whether that's one of the effects for you or not. The only way you find out whether you're fertile or not is by trying to conceive. And you're obviously not doing that for the moment. You don't do anything until you either get pregnant. Until you get pregnant, it's great, or until you say, look, I'm struggling to get pregnant. Up till that time, you just let it go. So that was easy. I don't have to do anything to prescribe you some stuff for your face. Is that all right?
Yeah, that was basically it.
Okay, how are you feeling now?
Still the same.
Still feel the same. Let's just see what your oxygen levels are as well. Your ECG looks okay. It's a little bit fast, but not as fast as it was. And are you normally quite fit and active? Do you do any sports at all?
No, not really, but I do like weights and that.
Right. I think the most likely cause is a faint, to be honest. Okay. But I would have thought you should have recovered by now, okay, because we're about 4 or 5 hours later. So I'm a little bit concerned because you've had a flight and you feel unwell with it and your heart is racing, okay. So what I think we need to do is ask the hospital to see you just to check there's no sign of a clot on the lungs. I think it's unlikely, but I don't want to miss it. So if you make your way to Ward 31B, they'll assess you further, okay, and just to be absolutely sure there's no clot there.
Right,
okay.
Thank you.
All right.
Thank you.
Okay, no problem. Bye-bye.
Right, Oliver, insect bite. Where's that then?
On the side of my leg.
This looks serious. When did this happen?
It happened a couple of days ago.
Right, where were you?
Ooh. I can't remember.
So when did you notice it? When you were at home later?
Yeah, when we got back from Greece.
Ah, you've been on holiday. Can we pop you on that bed there and then I can have a proper look at it? So look, so is it painful?
Yeah, stings.
So what's all this dry patch around here? Is this just crust from where it's been weeping a bit?
Yeah, probably.
Okay, let me get some gloves. It's a bit hard, isn't it? So it doesn't look infected at all. It's quite a nasty reaction. I think we just need to put a good dressing on that and just let it heal. Have you been scratching at it?
I was scratching it a little bit and then I stopped because it started stinging.
Yeah. If you scratch it and break the skin, then you get bacteria in from all underneath your fingers into the skin and you can end up with a nasty swelling all the way up your leg, and that's what we call cellulitis, and then you end up having to have antibiotics for that. Just give it a clean. What you want to keep an eye out for is if it starts spreading really far down, or if you start getting lines tracking up his leg or anything like that. If it starts getting really hot or his leg's actually swollen. Sorry. Have a look at it on Friday yourself. And if it looks pretty much the same, just change the dressing. I'll give you a couple. Just change the dressing, and then either way I would come back on Monday and see the nurses just to get it properly checked. So this is bright yellow, so you might see this coming through the dressing, so don't worry too much. If this does start irritating him for any reason, just take it straight off and just pop the plain dry dressing on. There we go. So you need to keep it clean and dry. So don't go jumping in the bath or in the shower with this, all right? So if you need to have a shower or a bath, you're gonna have to do it like that. Do your leg out the bath, all right? Some cow polish if it's sore. If it's hot, swollen, painful, outside of that dressing, bring him straight back. Thank you. You're welcome. I'll see you later.
Bye.